So I'm Alexander's line manager, and I've nominated him for Rising Star because since starting in the role last year as facilities manager in the South, he's achieved a massive amount. He's taken on 2 new services, which is transport services, that was brand new in the department, it's been a real success, and also the monitoring services, which was a big gap in the services as well. So they've both been really successful.
He shows all the trust values, he shows kindness every day towards ourselves and towards patients. He's always got time for everyone. He's always got ideas. At the moment, he's trying to implement a new laundry, which will save a lot of cost for the trust. He always does it with a smile on his face. I really think that he's a prime example of what great leadership, we follow. We all think such a lot of Alexander.
Alexander started with us through an agency at the end of 2021. And then in a few months he was successfully appointed Facilities Manager South. He's continued to grow, and I just think when you think of the words Rising Star, he really has kind of demonstrated that throughout his career, and I definitely know that he's going to go on kind of to further his career within the NHS. He really is an asset to Pennine.
Janaki's been a really valued part of the team since she came in around about a year ago. She's really supported us through a difficult period with the service in itself in terms of some staffing issues that she helped to support with. She's offered support to the wider team. Since she's been in the post, one of the really big impacts that she's had is she's managed to get our waiting list down. We have a 0 waiting list at present due to the commitment that she's made to the work, the extra work that she's picked up, and the breadth of skills that she's been able to utilise to help support the wider team actually bring that waiting list down completely. I think Janaki's an individual who can really progress really well and get really far, no matter which way she wants to go. She's got a good interest in research, and I'm sure if she wanted to go into that, she'd be a fantastic asset to that. As a physio, I think she'd be great within the clinical areas as well, and really help support and improve people's lives that she works with on a day-to-day basis. In the short time that she's been with us, she's progressed fantastic within her career as well, and has shown a real commitment to developing herself to progress as far as she can.
Olivia came into the community mental health team in a new role as carer support worker. We were having challenges at the time, and she sort of came into that role and just rolled with it. Seemed to be really very relaxed with the role. She took it on board, she made a lot of changes and really integrated carers back into the community mental health teams, which I think hadn't necessarily been done before, or there wasn't a focus on it. And she came just really enthusiastic, just really passionate about integrating carers, and I just feel like, it was really refreshing for when she first started. It was nice to have that energy. There's loads of things really that she's changed with that carers role. She did a big carers event on the Carers Week, which was in June, and she put a lot of work into that. These are just little things, and I guess they're little things but make a real big difference, and all that together, and her enthusiasm and her passion, it just rubs off on you. I think it just rubs off on people, and they become more enthusiastic about making carers part of the work that we do.